Hi friends, welcome back to allornonelaw. Today I'm going to talk very briefly and very important points for Usmle, that's a brain stem death. What is called brain death. Okay, brain death. What are the features for Usmle examinations? What are the important points you need to look for in a Usmle case scenario? That's really very important points you should remember. So I'm going to start with in United States of America. Okay, to call it as a what do you call a brain death, there should be a irreversible. Sorry for my handwriting. Irreversible absence of cerebral and brain stem reflexes. Okay, reflexes. So in United States, brain death to define is the patient should have irreversible absence of cerebral and a brain stem reflexes. So which are those reflexes? Like we have a pupillar reflex, right? The pupillar reflex. Then we have corneal reflex, right? Then we have gag reflex, right? Then we have extensor posturing reflex, extensor posture. Okay, then we have like what do you call caloric reflex, that is oculocephalic oculovestibular reflex, right? Then we can call the caloric. Okay, so and sucking reflex, you can call sucking reflex, right? So these are the important criteria you need to look for. Okay, so in the United States it's called as a brain death if the patient has an irreversible absence of cerebral or brainstem reflexes. That includes a pupillary, corneal, gags, swallowing, sucking. Then we have what you call sorry for that, let me take, okay, right? Okay, so now the other important things what you need to look for is the other what you call other criteria for a brainstem death are what you call if there's any apnea of the ventilator. Apnea is very important. Okay, if there's apnea of the ventilator of the ventilator of the ventilator for a duration that is sufficient to produce hypercapnia. What do you call hypercapnia is like to what do you call usually in a short period of time if it reaches more than 50 or 60 millimeter of mercury. Okay, within what you call 5 to 10 minutes if there is something that is observed. Okay, this is the minimum criteria I'm talking about. Okay, if there's a what you call EEG, in EEG if there's any electric what you call isoelectric for 30 minutes at a maximal gain. Okay, if it's isoelectric okay, isoelectric for 30 minutes okay, for 30 minutes. So remember, if the body temperature is above what you call 34 degree centigrade, or it will be around I think 93.2 Fahrenheit. Okay, 93.2 Fahrenheit. Okay, so very important points. Okay, the other important points, let me clear this screen. Okay, what do you call if there's any what do you call absence of cerebral blood flow in the Doppler, absence of cerebral blood flow on ultrasound or a Doppler or MRI angiography or whatever. Okay, and at least 24 hours of observation in adults with anoxic what do you call ischemic brain damage with a negative drug screen. These are very important things what you should remember. Okay guys, so thank you so much for watching this video. Trying to memorize, this is a really very important topic for Usmle step 1 or up to step 3. Thank you so much for watching this video. Take care.